हाय बच्चों, आप सभी का स्वागत है वर्क चैनल पे। आज हमारा ह्यूमन स्केलेटन सिस्टम का लास्ट लेक्चर होने वाला है, जिसमें हम अपेंडिकुलर स्केलेटन, जॉइंट एंड ह्यूमन स्केलेटन सिस्टम के कुछ डिसऑर्डर्स हैं जो एनसीईआरटी में उसके क्वेश्चंस देखेंगे। ठीक है, आई होप आप अपने नोट्स पढ़े होंगे, एनसीईआरटी पढ़े होंगे, आपके उनके सारे पॉइंट्स डाटा याद होगा। अगर नहीं है तो आप लेक्चर्स को देखें, अगर उसके बाद आप देखेंगे तो आपको और अच्छे से भी याद होगा। ठीक है, तो पहला क्वेश्चन है, ये मतलब शुरू करते हैं। द अपेंडिकुलर स्केलेटन कंसिस्ट ऑफ द बोन ऑफ द लिम्स एंड देयर ऑप्शन है जॉइंट, मसल, गर्डल्स या फिर कार्टिलेज। तो जो अपेंडिकुलर स्केलेटन है वो कंसिस्ट ऑफ बोन्स ऑफ द लिम्स एंड देयर गर्डल्स। Each limb is made up of how many bones? 28, 30, 32 या 34? Each limb is made up of 30 bones. Which of the following is a bone of forelimb? Femur, tibia, humerus या patella? Humerus. The bone of the forearm are the humerus and ulna, radius and ulna, carpals and metacarpals, tibia and fibula. Radius and ulna. How many carpal wrist, जिसे हम कार्पल को रिस्ट बोन भी कहते हैं, देयर इन वन हैंड? 5, 7, 8 या 14? 80 नंबर होते हैं। द बोन ऑफ पाम आर कॉल्ड carpals, metacarpals, tarsal या फिर phalanges? The bone of palm are called metacarpals. How many metacarpals bone are there in one hand? 5, 7, 8 या 14? 5 metacarpal bones. The bone of the digit finger are called carpals, metacarpals, phalanges या फिर tarsals? Phalanges. How many phalanges are there in one hand? 5, 7, 14 या 28? 14. The longest bone in the human body is the humerus, femur, tibia या fibula? Femur. The bone of the leg and limb include humerus, radius, ulna, femur, tibia, fibula, carpals, metacarpals, phalanges, clavicle या फिर scapula? सही आंसर है इसका femur, tibia and fibula. How many tarsals ankle bones are there in one foot? 5, 7, 8 या 14? 7. The bone of the sole of the foot are called tarsal, metatarsal, phalanges या फिर carpal? The bone of the sole of the foot are called metatarsal. How many metatarsals bone are there in one foot? 5, 7, 8 या 14? 5. How many phalanges are there in one foot? 5, 7, 14 या 28? phalanges हाथ या फुट में दोनों में कितने नंबर होते हैं? एक हाथ और एक पैर में 40 नंबर में होते हैं। The patella is a bone that covers the knee dorsally, laterally, ventrally or medially? Ventrally. The patella is commonly known as ankle bone, kneecap, sine bone या फिर heel bone? Kneecap. Pectoral and pelvic girdle bone help in articulation of limb with the appendicular skeleton, exoskeleton, skull या फिर vertebral column alone? जो पेक्टोरल एंड पेल्विक गर्डल बोन है वो आपको किसमें हेल्प करता है? आर्टिकुलेशन ऑफ लिम्ब विद द एक्सियल स्केलेटन. Each girdle is composed of one bone, two half, three part या four bones? Each girdle is formed of two half. Each half of the pectoral girdle consists of humerus and scapula, clavicle and humerus, clavicle and scapula, scapula and sternum. Each half of the pectoral girdle consists of clavicle and scapula. The scapula is described as a small round bone, large triangular flat bone, long slender bone, or cup-shaped bone. Large triangular flat bone. The scapula is situated in which part of the thorax? Ventral, dorsal, lateral, anterior? dorsal. The scapula is located between which ribs? First and fifth, second and seventh, third and eighth, या fourth and tenth? Second and seventh. The slightly elevated ridge on the dorsal surface of the scapula is called. स्कैपुला के डॉर्सल साइड पे यानी डॉर्सल सरफेस पे एक एलिवेटेड रीजन है, उसे हम क्या कहते हैं? स्पाइन. The flat expanded process projecting from the spine of the scapula is called glenoid cavity, acromion, coracoid process या फिर supraspinous fossa. The flat expanded process projecting from the spine is called acromion. Which bone articulate with the acromion of the scapula? Humerus, sternum, clavicle या rib? Clavicle. The depression below the acromion of the scapula is called the coracoid fossa, supraspinous fossa, glenoid cavity या infraspinous fossa. जो डिप्रेशन बिलो acromion होता है उसे हम कहते हैं glenoid cavity. The glenoid cavity articulate with the which bone to form the shoulder joint? Clavicle, sternum, head of humerus या फिर ulna. जो glenoid cavity है वो आर्टिकुलेट करता है हमारे हेड ऑफ ह्यूमरस से क्या फॉर्म करने के लिए? शोल्डर जॉइंट. The clavicle is a short flat bone, long slender bone with two curvature, triangular flat bone या फिर irregular bone? Long slender bone with two curvature. The clavicle is commonly known as shoulder bone, shoulder blade, collar bone, breast bone या hip bone? Collar bone. The pelvic girdle consists of how many coxal bones? 1, 2, 3 या 4? Pelvic girdle दो coxal bone consist करते हैं. Each coxal bone is formed by the fusion of 2 bones, 3 bones, 4 bones या 5 bones? 3 bones. Which 3 bones fuse to form a coxal bone? Ilium, ischium, sacrum, ilium, ischium pubis, ischium pubis coccyx या फिर ilium pubis femur? Ilium, ischium pubis. The cavity formed at the point of fusion of ilium, ischium and pubis is called the glenoid cavity, acetabulum, obturator, foramen या फिर pubis symphysis. The cavity formed at the fusion of ilium, ischium and pubis is called acetabulum. The acetabulum articulate with which bone? Patella, tibia, femur, thigh bone या फिर sacrum? तो acetabulum articulate with femur. The two halves of the pelvic girdle meet ventrally to form the acetabulum, obturator, foramen, pubis symphysis या फिर sacroiliac joint. तो फॉर्म करता है आपके pubis symphysis. The pubic symphysis contain hyaline cartilage, elastic cartilage, fibrous cartilage, bone tissue. तो जो pubic symphysis contain करता है fibrous cartilage. Joint are essential for growth of bone, types of movement involving bony part, production of blood cells, या फिर storage of minerals. तो joint are essential for types of movement involving bony part. Joint are a point of contact between bones and muscle, bones or bones and cartilage, muscle and tendon, या फिर ligament and tendons. The joints are a point of contact between bones or bones and cartilage. The force for movement through a joint is generated by bone, cartilage, muscle, and ligament. The force for movement through a joint is generated by muscle. In movement, a joint acts as lower default fulcrum of lever. तो in movement, the joint कैसे act करता है? fulcrum की तरफ. The movability of joint varies depending upon the bone size only, different factor, muscle strength and only the type of cartilage present. The mobility of joint depend upon different factors. किस लोकेशन पे है, कैसे टिश्यूज बने हुए, ये सब पे. Joint are classified into how many major structural form? 2, 3, 4 or 5? 3. The 3 major structural form of joint are fixed, semi-movable, fibrous, cartilaginous, synovial, hinge, pivot या ball and socket या फिर suture, syndesmus या फिर gomphoses. The three major structural joints are formed by fibrous, cartilage, and synovial. Fibrous joints allow free movement, allow limited movement, do not allow any movement, as are filled with synovial fluid. The fibrous joints do not allow any movement. An example of fibrous joint is found in the knee, elbow, skull, cranium, vertebral column. An example of fibrous joint is found in the skull. Cranium भी कहते हैं. In a fibrous joint of the skull, bones are joined by hyaline cartilage, synovial fluid, dense fibrous connective tissue, suture, elastic cartilage. In fibrous joint, the skull's bones are joined by dense fibrous connective tissue, जिसे हम suture कहते हैं. In cartilaginous joint, bones are joined together by fluid, ligament, cartilage, fibrous tissue, cartilage. The joint between adjacent vertebrae is an example of fibrous joint, synovial joint, cartilaginous joint, separate suture. The joint between adjacent vertebrae is an example of cartilaginous joint. Cartilaginous joint permit no movement, extensive movement, limited movement only, rotational movement only. The cartilaginous joint permit limited movement. Synovial joints are characterized by the presence of a solid connective tissue pad, fluid-filled synovial cavity, dense fibrous suture, lean cartilage disc. The synovial joints are characterized by the presence of fluid-filled synovial cavity. Synovial joints allow no movement, limited movement, considerable movement, move only in one plane. तो synovial joint जो मूवमेंट अलाउ करता है वो कंसिडरेबल होता है. ठीक है, तो कंसिडरेबल मूवमेंट हम ऑप्शन सही है. Synovial joints are important for production of organ, locomotion and other movements. Mineral storage and blood cell production. So synovial joints are important for locomotion and many other movements. A ball and socket joint is present between humerus and pectoral girdles, knee joint, atlas and axis and carpals. A ball and socket joint is present between humerus and pectoral girdle. The knee joint is example of ball and socket joint, hinge joint, pivot joint, gliding joint. So knee joint is example of hinge joint. A pivot joint is found between humerus and scapula, carpals, atlas and axis, epicarpal and metacarpals of the thumbs. The pivot joint found between atlas and axis. A gliding joint is found between humerus and the pectoral girdles, the carpals, knee joint या फिर adjacent vertebra. जो ग्लाइडिंग जॉइंट कहाँ मिलता है आपके कार्पल्स में. A saddle joint is found between humerus and pectoral girdle, carpals and metacarpals of thumb या फिर atlas and axis. A saddle joint is found between carpals and metacarpals of thumb. Myasthenia gravis is autoimmune disorder. Affect the muscle fiber directly, neuromuscular junction, bone marrow या फिर synovial membrane. तो मिस्थेनिया ग्रेविस कैसा आपका ऑटो इम्यून डिसऑर्डर है जिसमें वो क्या अफेक्ट करता है न्यूरोमस्कुलर जंक्शन को. द प्राइमरी सिम्टम्स ऑफ मिस्थेनिया ग्रेविस इंक्लूड इंक्रीज बोन डेंसिटी, फैटिग, वीकनिंग एंड पैरालिसिस ऑफ स्केलेटल मसल या फिर जॉइंट इन्फ्लेमेशन एंड पेन या फिर एक्यूमुलेशन ऑफ यूरिक एसिड क्रिस्टल. द प्राइमरी सिम्टम्स ऑफ मिस्थेनिया ग्रेविस इज फैटिग, वीकनिंग एंड पैरालिसिस ऑफ स्केलेटल मसल. Muscle dystrophy is characterized by temporary muscle spasm, progressive degeneration of skeletal muscle, inflammation of the joint with decreased bone mass. The muscular dystrophy is characterized by progressive degeneration of skeletal muscle. Muscular dystrophy is mostly caused by low calcium level and autoimmune reaction, a genetic disorder with a high uric acid level. तो muscular dystrophy किससे होता है? एक तरह का आपका autoimmune disorder है या फिर genetic disorder है. तो मस्कुलर डिस्ट्रोफी आपका एक तरह का जेनेटिक डिसऑर्डर है, जबकि मिस्थेनिया ग्रेविस ऑटोइम्यून डिसऑर्डर था. ठीक है. Tetany is caused by the high calcium level in body fluid, low calcium level in the body fluid, accumulation of uric acid after autoimmune destruction. तो टेटनी caused by आपका low level of calcium level in body fluid. इससे होगा कि अगर हमारे बॉडी में कैल्शियम का अगर लेवल लो होगा तो क्या होगा, जो आपके ट्रोपोनिन है जहाँ पे कैल्शियम के साथ बाइंड करके आपके माइसिन पे जो कवर करता है वो कवर नहीं कर पाएगा, इससे हमारे क्या होगा, मसल कंट्रैक्शन होगा. ठीक है. तो टेटनी इज कॉज्ड बाय लो कैल्शियम लेवल इन बॉडी फ्लूइड. द मेन सिम्टम ऑफ टेटनी इज प्रोग्रेसिव मसल वीकनेस, रैपिड स्पैज्म, वाइल्ड कॉन्ट्रैक्शन ऑफ मसल या फिर जॉइंट स्टिफनेस या फिर बोन फ्रैक्चर. द मेन सिम्टम ऑफ टेटनी इज रैपिड स्पैज्म, वाइल्ड कॉन्ट्रैक्शन इन मसल. Arthritis is defined as degeneration of muscle tissue, inflammation of joint, decrease in bone mass, accumulation of crystalline muscle. So arthritis is defined as inflammation of joint. Osteoporosis is a age-related disorder characterized by increased bone mass and strength, decreased bone mass and increased fracture risk, inflammation and swelling joint, uncontrolled muscle contraction. The osteoporosis is age-related disorder characterized by inflammation, नहीं, decreased bone mass and increased fracture risk. ठीक है. A common cause of osteoporosis is high level of estrogen, low level of uric acid, decreased level of estrogen या फिर high calcium intake. A common cause of osteoporosis है आपका decreased level of estrogen, जो कि mostly women में होता है ना. Gout is caused by the inflammation of joint due to accumulation of calcium crystal, uric acid crystals, enable fluid rapid cartilage phlegm. जो हमारा गाउट है जो कि इन्फ्लेमेशन ऑफ जॉइंट है किसके कारण होता है? आपके यूरिक एसिड क्रिस्टल के एक्युमुलेशन से. ठीक है, तो हमारा चैप्टर हुआ कंप्लीट. हम मिलते हैं अब नेक्स्ट लेक्चर में. तब तक के लिए अपना ख्याल रखिए. स्टे मोटिवेटेड गाइस. बाय बाय.